Dr. Humphrey, Stephen Sterner doing the video assessment number 2. And let me show you the room. And I'm going to be starting with the eyes. And I'm going to start with inspection and palpation, just looking at the eyes. They are symmetrical. The eyebrows themselves are even, they're thin, but yet they do have, hair that is equivalent to or consistent with the hair on her head. And the eyelashes are also consistent with that in color, a little bit more coarse than the hair on her head and the eyebrows. They are upward and outward sloping on top, and on the bottom they are downward sloping. Close your eyes for me. Palpating the eyes, palpating the lacrimal duct and the lacrimal sac. The globe and the position of the globe is normal over your eye, and does not show any exophthalmos. The conjunctiva is pink, and the sclera is white with a few vessels showing. Pupils are round. And what I want you to do for me is just look straight ahead at me. All right, now what I want you to do is look over my shoulder there at that wall. When I tell you to, I'm going to bring up this pin light, and I want you to look at it. And then I'm going to bring it in close to your nose and just follow it into your nose, okay?
Okay.
All right, shift your gaze. Follow it in. Okay. All right, so the eye, the pupil itself is reactive to light, direct light, and also consensually. And it is, the pupils constrict or accommodate constrict during accommodation. We will check visual acuity, and we are going to be assessing optic nerve, or the optic nerve, cranial nerve number 2. And with this, we would be doing 3 different tests. The first one will be a Snellen test, which is a card that is on a wall 20 feet away. You would cover one eye, then cover the other eye, and then do it with both eyes, visualizing the chart. If you have corrected vision, you would do it with uncorrected first, and then subsequently do the corrected vision, and that's the Snellen. The Rosenbaum test is a card that is handheld that's about 14 inches away from your eyes, and you would do that the same way as the Snellen test with uncorrected and then corrected vision. Now we are going to do visual fields test, and it's going to check the peripheral vision. So what I want you to do is to cover one of your eyes for me, and I'm going to cover my eye on the same side, and then I'm going to bring this pin light in, and I just want you to tell me when you see it.
Okay.
All right.
No. No. No.
Sorry.
No. No. No.
check. The retina. And do the ophthalmoscope test. And for this test, we would normally do it with the light off. And I'm going to be checking the inside of the eye, the fundus. Look straight ahead over my shoulder. I do see red reflex, so I see the light reflecting off of the retina. So I do see the fundus, and the fundus is a creamy yellow color, and the vessels are coming out of the fundus, and if we look at those vessels, our arterioles are brighter in color, a little bit bigger than the venules, and they are at a ratio of 2:1. If we follow those vessels medially, we come to the optic disc, and the optic disc is round. It's about 1.5 centimeters in diameter, and there's no physiologic cupping. And if we follow those vessels from the optic disc to the macula densa, and we see that it is gray in color. It has the fovea centralis in the center, and that is where there is the best vision in the eye. We'll go on to the ears. And just looking at the ears, I'm seeing that the auricles are symmetrical, even. There's no lesions or no drainage, no injuries of any kind. We'll take a look inside the eye, or excuse me, inside the ear. So I do see a cone reflex, a light cone reflex, and it is at 5 o'clock here in the right ear. It would be in 7 o'clock in the left ear. The tympanic membrane is a pearly gray or a translucent gray color. It is also intact. There is no perforations. There's no scarring. The umbo and the malleus, as well as the they are present and appear to be normal at this time. So at this time, what we're going to do is we're going to do a whisper test. So what I want you to do is occlude your left ear for me. I'm going to whisper something in this ear, and then I want you to tell me what I said.
Leo is your favorite dog.
Yep, that is correct, and we would do this bilaterally. And testing the hearing, we're actually testing the vestibular cochlear nerve, which is cranial nerve number 8. And in doing that, we would do the whisper test, and also we're going to do the Weber test and the Ryan test. And the Weber test will activate the tuning fork. I'm going to activate this. I'm going to set it on your head like this. And what I want you to do is tell me if you hear it in one ear over the other or both ears.
Okay. Both.
All right, that's the Weber test. Now we'll do the Ryan test. On the Ryan test, what we're going to do is I'll activate it again. I'll place it on the mastoid process. Okay, and I want you to tell me when you stop hearing it.
Okay.
And then I'm going to take it, I'm going to place it in front of your ear. And then again, I want you to listen to it until you can't hear it anymore and tell me now.
Okay.
Okay.
Now.
Still hear it?
Now.
Okay. And with that test, we can determine that the bone conduction is half of what the air conduction would be. So the air conduction is 2-to-1 ratio over the bone conduction. And again, we would do that bilaterally. Looking at the nose, it is symmetrical with the face. It is appropriate sized. The nares appear to be equal. The septum appears to be midline. There are some scattered primary lesions in the form of macules over the bridge of the nose. So the septum is midline. It's not deviated or there's no perforations in the septum. The mucosa is pink or dark pink. It's moist. There is no edema or inflammation. Turbinates are present. And again, we would check this bilaterally. At this time, we're going to do a smelling test, and what that does is it will actually test the olfactory nerve or the cranial nerve number 1. So I have some things here I want you to smell, and I want you to tell me what it smells like. They're very recognizable.
Okay.
All right, so close your, first before we start, occlude one side of your nose. Now take a deep breath. All right, now do the other side. All right, so I'm going to have you close your eyes, and then I'm going to have you smell these. Keep your eyes closed,
Okay.
and then tell me what it is.
Close.
I forgot to have you close the side of your nose. So let's do it again.
Okay.
All right, so occlude one side of your nose. All right. Now again.
Close.
All right, and the other side. Okay,
Ginger.
very good. All right, now we will go on to the mouth. The lips are pink, moist, they're not chapped. your mouth for me. Alright, looking at the mucosa, it is pink. Buccal mucosa, I don't see any lesions or any trauma. The gums are not receding. And the teeth, there's 2 cavities and put your head down a little bit for me. There you go. There's 28 teeth and there are 4 cavities or 4 fillings. The others appear to be unremarkable. Alright, open your mouth a little more. Alright, the frenulum is intact on the bottom here. Also under the tongue is intact. And up here is also intact. We have on the bottom Wharton's ducts, which are palpable and freely flowing. And then at the second molar, Stinson's ducts are present and freely flowing as well. The uvula is midline. Stick your tongue out. And it does rise and fall. The hard palate is rugate and goes back to the soft palate. So open your mouth again, stick out your tongue, and move your tongue back and forth. Okay, very good. All right, so with these tests that we've done here, we have, we're checking the cranial nerve number 9, which is the glossopharyngeal nerve, and the cranial nerve number 10, which is a vagus nerve, and they innervate the soft palate, and they also help with gag reflex and the rise and fall of the uvula and the soft palate, and swallowing as well. And then with the tongue, we have that is cranial nerve number 12, and that's hypoglossal. So at this point, we're going to move on to the thorax. So if I could have you remove your shirt for me. Would you like a blanket? Okay. All right. So I'm looking at the thorax, and the skin is the same color as the rest of the skin of the body, very consistent. There are some primary lesions noted that are in the form of macules. They are scattered throughout. I don't see any asymmetrical breathing. It is symmetrical. The expansion of the chest is appropriate. All right, I'm just going to go ahead and palpate your chest or touch your chest here, and I want you to tell me if anything hurts. Anything there?
No.
And anything back here?
No.
So I'm going to go behind you here. And I am going to palpate or percuss. And I'm just listening. Right. Now what I want you to do is, I'm gonna place my hands here like this, and I want you to say 99, okay?
Okay.
Alright.
99, 99, 99.
Alright, very good. So Formitis is actually present, and I can feel that in the ulnar aspect of my hands. I want you to breathe normally. I'm going to listen to your lungs. Okay. Just breathe normally again. Alright, I'm going to have you lie down. This under your knees. Let me walk over here. Alright, at this point we're going to be checking the cardiovascular system, and first thing that I will check is going to be any heaves or thrusts in the chest, and none are noted. And I'm just going to be touching your chest here. So at the fifth mid-clavicular or intercostal space, mid-clavicular line, is the apical pulse, or the point of maximum impulse. And the apical pulse is present. The second intercostal space the left third intercostal space is Erb's point. 4th intercostal space. Tricuspid. And we're back at that left 5th intercostal space, or the point of maximum impulse, and the mitral valve, the mitral sound. And then the right 2nd intercostal space. Sternal border is the tricuspid and mitral valves, when they're heard, they are in the left 4th and 5th intercostal space, and the S2 sound is greater than the S1 sound. The atrioventricular and the pulmonic are more readily heard in, or the S2 is greater than the S1, and then Erb's point is equal to, so S1 is equal to S2. And I would continue. I'm going to check the temporal pulse, brachial, and radial. As well as popliteal. And retrotibial. And then the dorsalis pedal pulse. Right. And that concludes our assessment. Dr. Humphreys, that concludes this assessment, and I look forward to your critique. Thank you. And I'll show you the room one more time.